Australian community pharmacies rose to the many challenges of 2020, including bushfires, a global pandemic, and a raft of ongoing changes within the industry, continuing to support their communities every day. 2020 demonstrated there was not one Pharmacy of the Year winner, but 5,900 of them. They supported their communities through the 2019-2020 summer of bushfires, providing ongoing and sometimes 24-hour support to evacuees, firefighters and the local community. Packing dose administration aids by candlelight, donating toiletries and other items to families stranded in local evacuation centres, and supplying and delivering medication to people in need. When the pandemic hit, they worked extra hours, drove thousands of kilometres to deliver medicines, effectively communicated with their patients to dispel fear, and set up their pharmacies to keep people safe.
Once the fires finished, I had this sort of a reset idea in my head that the fires are over, we can start fresh, start the year again. About 10 days, 2 weeks later, COVID-19 began. We started early trying to treat it seriously and planning for the worst, and that very rapidly sort of came to fruition. Our immediate goal was how we continue to provide that essential medication service to the community while at the same time keeping our staff safe.
COVID stole from the bushfire people their 5 minutes to catch up. So they're still going now, today. Our major focus at the moment is how do we continue to support these people mentally when things are only just going to sort of start to come to fruition with people dealing with the things that they saw and getting through the fires.
We knew what you were going through. We lived it too. We were there despite challenges faced, continuing to provide that same level of excellence you've always depended on.
Unfortunately, with most of the pharmacies that happened, all these essential products at the time of COVID-19, like hand sanitizers, it all went out of stock. We brought in all the raw materials, most important being ethanol or isopropyl alcohol, and started making hand sanitizers to be able to support the public demand.
We were working ridiculous amounts of hours, 70 plus hours. It's really stressful, but at the same time, you actually felt empowered that you were doing something positive. You knew people were relying on you.
When the government announced the home medicine service funding, we jumped on that straight away to ensure that our customers could stay at home and we could still help them get their medicines. Up to this point, we have done over 1,500,000 kilometres in deliveries.
This year, we've had to adapt quite a lot to what we would normally be doing. The sheer volume of prescriptions that came through in early March, we had to really quickly create different systems to get prescriptions done as quickly as possible because no one wanted to wait in store. And we're really mindful of that, especially because a lot of our customers are quite elderly and Indigenous.
We've also had to support our team and our community to make sure that their mental health and wellbeing is okay. It's been such a tough year for everyone, but I also think it's strengthened our relationships with our patients and our teams as we're all in this together and we're all going through the same challenging year.
Things like our blood pressure testing, because people have felt quite anxious, so they want to get their blood pressure checked and they haven't found anyone, their GPs won't do it. So we've put in procedures to try to do that as safely as we can. So people have been really grateful for that.
A lot of people talk about the new normal. What's the new normal? And what I'm excited about is what are we going to take out of this year forward? All of that technology and changes to legislation and electronic prescribing and apps where patients can order their medicines online, see the whole profile online. The importance of my health record even came up. And if we need to do contactless delivery, we can.
People have sort of sought solace in just coming in to get some reassurance and to feel that they've got some support from health professionals,
We have also utilised our increased scope of practice, particularly the continued dispensing. And this has been really useful when we've had patients that have run out of their prescriptions and we've been able to provide them with ongoing supply for a month.
It's wonderful to know that pharmacy is now being thought of as a required service, that we are frontline health workers and are needed in our communities.
Being a frontline health professional that they can just walk in the door and get advice, support, help. I think people have really appreciated that and seen it in a bit of a different light.
In such uncertain times, one thing is absolutely without doubt, and that is pharmacies will continue to be there for their patients and their community, keeping their doors open to deliver care and advice.
On my very worst days this year, all I have had to do is step back and look at my colleagues across the country and really look at the difference that they have made with their community. Every single community pharmacist I know has not shied away from this experience. What I have continued to see through the bushfires and through COVID is that a community pharmacist's commitment to providing healthcare to their community in partnership with the government and delivering the PBS, we have never done it better. If there was ever a year in Australian history where our industry should be incredibly proud of what we've done, it's been this year, because all of us have made incredible sacrifices physically and emotionally and financially to keep our businesses going, to support our teams and to be there for the people in our community.
We salute your courage, commitment and dedication in serving our communities daily as a vital part of Australia's healthcare system.